Hi, my name is Dr. Fox, and I'm a licensed psychologist in the state of Texas. And in this video, we're going to talk about kids, specifically how they have dealt with or how they're trying to manage the psychological repercussions of having to have gone through the COVID pandemic. This might be a difficult video for you to watch, so please take it as best you can. Take it slow, digest the information. You may want to have a pen or pencil to write down some notes for yourself. I hope that you find this insightful. I think that what we're seeing in these kids, and I'm calling them the COVID kids because they have come out of this COVID pandemic and it's like nothing any of us have ever seen before. And a lot of children that went through it, children and adolescents who went through it, we're seeing some residual psychological issues. And the research certainly supports it. If you look in the news, you'll hear about it as well. So I wanted to relay some research-based information and hopefully just rein in some of those fears and uncertainties that you may have and that you may be experiencing, that many of us have and are experiencing. So let's get into it. Please like, share, and subscribe. Check out some of my other videos if you'd like. But let's look at the COVID kids, the pandemic impact on children and adolescents. In this video, we're going to discuss the global impact of the COVID pandemic on the children and adolescents who endured it. These are what I call the COVID kids. Now, we're going to discuss what made the children and adolescents who were isolated or quarantined during the pandemic more vulnerable to develop acute stress disorder, adjustment disorder, depression, anxiety, grief, or other mental health concerns. I'm also going to talk about what we can do about it for our kids going forward. So it's not just relaying all the bad news, it's also what can we do with this news to help our kids, our children, and adolescents. The effects of the COVID-19 pandemic are problematic and potentially long-lasting on the mental health functioning of children and adolescents, particularly in those with underlying psychiatric and or developmental disorders. Being home from school and separated from peers during this crucial developmental period, young children and adolescents, they were among the individuals most negatively impacted. And they were impacted in various ways by the pandemic lockdowns all around the world. Anxiety, absence of peer contact, lack of stress regulation, domestic violence, and child maltreatment threats are significant concerns for the mental health of this population. And you might be thinking, well, you said that it was a lack of contact, but my kid was texting or emailing, things like that. It's very, very different. It is very psychologically different when you text a friend or Snapchat a friend or Instagram a friend, whatever they do, is different than seeing them face to face, than having that physical engagement. And research has supported that for years way before the COVID pandemic kicked off. Research has found that from March 2020 through February 2021, there was a rapid and sustained 10% increase in outpatient mental health service utilization by children and adolescents compared to prior rates. The outbreak of COVID-19 had a complex and considerable impact on child and adolescent mental health, with the most frequently reported psychological issues being anxiety, depression, loneliness, stress, fear, tension, anger, fatigue, confusion, and worry. And these are directly related to those psychological issues I mentioned just a moment ago. Furthermore, psychological qualities such as emotional reactivity and experiential avoidance among adolescents are likely to add to the increased risk of developing psychosocial disorders, such as social anxiety, agoraphobia, depression, generalized anxiety, and others. Now, a 2021 study found a twofold increase in the global prevalence of depression and anxiety for children and adolescents, with higher rates for adolescents and girls. Other studies have found increasing rates of anxiety, depression, and suicidal behaviors among school-age children and adolescents. And this is even more so for girls. This has increased emergency visits and hospitalizations, as well as long wait times for acute psychiatric care. Additionally, quarantine-related financial loss was found to be a risk factor for developing psychological symptoms. Children were significantly concerned about family-related financial loss, parental employment status, future uncertainties, and resource vulnerabilities, which includes daily needs like food, water, housing, and internet. During the quarantine period, talk to your child about the state of your finances to the degree you feel comfortable. Even now, even if you're like, well, COVID is behind us, the quarantine is behind us, these are the lasting effects that a lot of our children and adolescents carry with them. And that fear of being homeless is likely a real fear that they experienced and something that we need to address with them. Talk it out with them and explain it to the degree relating to your finances that you feel comfortable. The development and utilization of negative coping strategies, including behavioral avoidance, denial, and substance use, is a significant risk factor for depression, anxiety, and stress symptoms in high school students, but it intensified in the COVID kids. And it even started to skew earlier, which means younger kids. We all have to work together to help them weather this storm, even though if it seems like that COVID has receded or it's not that bad or whatever it may be, there are lasting effects that our children are dealing with and our adolescents are dealing with. So we have to know, how can we help our children? Well, I'm going to give you some suggestions on what you can do about it. Now, possible interventions according to risk factors, psychological needs, coping strategies, personal experience, and social responses. First, you want to get a sense on how your child or adolescent copes in good ways and bad. Don't accuse them of it. Don't chastise them for it. You have to assess, okay, so my child manages stress this way. My child manages stress this way, whether it's maladaptive or is it an adaptive way to manage their stress, fear, and concern. Don't charge them when you don't say, well, you shouldn't do this and do this instead. They've already got enough issues and fears and worries in order to do that. So we don't want to compound that. So first we want to do, just to reiterate again, is to go back and get a sense of how your child or adolescent copes in good ways and bad. Now we want to talk about positive coping strategies. If you've seen my other videos, you know that I'm a huge proponent of adaptive coping strategies. Positive coping strategies include actively reducing stress. That sounds like a good one, right? Which is identifying what their stressors are. We have to build insight. A lot of issues, right? When I was a teenager, I didn't have great insight. A lot of teenagers don't. Kind of comes with the territory, right? We also want to help them develop accurate knowledge about the pandemic. Get honest and accurate information and discuss it, even though it may seem to have receded, or it may not be a big deal in your area, or it may be a big deal. Discuss it and process it. Even if you feel like it's not relevant, it's relevant to them because they're carrying that issue forward. How about connecting with friends and family members? Plan those get-togethers, physical get-togethers. COVID kids are likely to be resistant to this at first, but they may warm up once they're in that social setting. And it helps to build those social skills they may have lost by being in quarantine during that critical adolescent developmental period. Also, engaging in physical activities, working out, sports, whatever it may be, getting outside, getting engaged with others, and limiting leisure screen time. I know that can be really difficult, but if you see that they're just fixated on their phone, how can you curb that? Maybe having dinner together. And no one is allowed to use their phone. That includes adults as well. And if you have to use your phone, explain why you're using your phone. But we want to increase that physical contact, that physical connection. And we want to talk about cognitive restructuring. Cognitive restructuring is that you take an issue or a concern and you're going to learn how to manage it and restructure it in a more effective way. So at first you may see something as very maladaptive, fearful. It could be, for example, that, well, those people over there, they look like they're fun and they're cool, but if I go over there to meet them, they're going to think that I'm this lonely loser, so I'm better off just being by myself. But then they have this little voice, right, that builds up in their head that says, see, you're a lonely loser. However, if we're going to cognitively restructure that, what we want to do is we want to look at that situation. We want to say, okay, what do we want out of that situation? We want positive engagement. We want to perhaps expand our social circle. So how can you connect with those people? Going up to a group of kids or, because we're talking about adolescents and children, going up to a group of others is really scary, right? Could you wait until one person is there or till another person? Or could you try to meet one person Now at school, if your area has schools, how can you meet and connect to one person? And you want to work to cognitively restructure that internal negativity that's telling you that you're a lonely loser. And you do that by challenging it. You do that by pushing back, not by receding. And that's one of those big maladaptive patterns that a lot of children and adolescents learned, is that, well, we're all lonely losers, so we're going to stay in our room. We're going to stay fixated on this device, right? On this phone, on this computer, whatever it is. And we're not going to socially engage. So they don't develop that critical strategy of realizing how to meet people, how to connect to people. And it's really important to do that. I can do a specific video on cognitive restructuring. If you'd like, leave that in the comments and I'll check that, and I'll make a whole video on cognitive restructuring for you. Let's keep going forward. Let's go to the next one, and that's going to be family support. Now, for family support, we want to look at what are those negative mood states, such as anxiety, depression, and stress, due to that long-term lockdown, due to that quarantine. And this may increase family tension and the likelihood of conflict between children and other family members. And that may have happened. But we have to revisit that with your child or adolescent. You have to try to make that connection. You have to push whatever type of issue or problem that may have been and push back on it and move forward in order to connect. You want to use family supportive techniques such as managing your own stress and monitor your own moods. Family therapy can be a great option. Engage with your kids. Talk about what it was like to be a family during quarantine, to be a family that is now trying to pull themselves back together after the COVID-19 pandemic. And that doesn't mean, well, just pointing it at your kid and saying, well, you did this, you did that. We don't want to do that in an accusatory fashion because that's going to create greater psychological distance. You don't want to do that. You want to talk about your own fears, open the door that way, perhaps some fears you have for them. And it shouldn't be accusatory, which is that, well, I'm afraid that you're going to end up doom, doom, doom. That's not supportive. You can talk about, that I was really afraid during the pandemic that things might not normalize, that not only how that'll impact my life, but how will that impact your life going forward? That really scared me. What do you think about that? And that would be another way to be supportive of your child or adolescent and move forward. The next component, let's talk about social response and support. Schools, social media, healthcare, and government support is obviously urgently needed. And I know that a lot of governments are starting to pull back. A lot of schools, social media, things like that, people are kind of pulling back because they're like, oh, well, this whole COVID thing is kind of over right now. Everything is at a lull. It's just fine. Well, again, these kids are still carrying the issues and concerns that were developed. Now, schools are ideally supportive environments for adolescents to stay connected with their peers and their teachers. The teachers, however, are also going through their own stuff too. And teachers, in my opinion, are overworked and they're dealing with so much as well. So I'm a firm believer in supporting teachers, absolutely. So I think that we have to take that with a grain of salt, but also I think the social environment of schools is very, very important. Reality is that it may not be that way, that sometimes schools, getting back into school was very scary, or maybe they haven't been able to adjust or reacclimate to schools. But ask your child about their school and the environment. And if they give you those one-word responses, you don't accept that, don't chew them out, but encourage them to talk to you. Use patience in conversation to engage them. And recognize that information changes so rapidly. Television and social media largely consisted of news about COVID-19, about the disease. Social media are among the most widely used sources, which are often used maladaptively, but they can be used as a constructive coping strategy for adolescents to manage negative emotions that were evoked by the COVID-19 crisis. So it's really important, even though social media may appear just all negative and all of this other stuff, and it creates all of these negative problems, it can be used in a very positive way to help kids learn about the pandemic, that they're not alone, that COVID kids are not alone, that this is something that a lot of kids and children and adolescents experience coming out of that COVID pandemic and the lockdowns and the quarantines. Now, lastly, research shows that adolescents who adhered more closely to the restrictions, stay-at-home orders, and who felt more socially connected during the pandemic lockdown were less likely to experience anxiety, depression, or decreased life satisfaction. Connection is key to helping your child or adolescent overcome this period in their life. Help them catch up from the time that they missed. But it is a slow process. There's no medication that's going to magically make it go away. There's no one therapy appointment that's going to make it magically disappear. It is going to be a process. And it is one that takes patience and the recognition of your own fear and the fear of how it has impacted your child. But I hope that you found this video helpful and hopeful. So please like, share, and subscribe. Check out my other videos if you like. But ultimately, be well and take care of those most important people in your life. I wish you well. Bye-bye.